Okay, the screen is visible, huh? Lecture number 13, microcirculation. Micro means it is happening in capillaries. Circulation happening in capillaries is known as microcirculation. Okay, full screen. What we are going to learn in this lecture, the role of arteries, not arterial, in distribution of the cardiac output and regulation of the blood pressure. So this lecture is a sort of revision for 2-3 lectures before, even some lectures from PHSL block. You will find the slides related to the PHSL block. Okay, recognize the importance of mechanisms of control of blood flow in various organs. What are the mechanisms which are controlling the blood flow? What are the factors which are regulating the size of their or the radius of the arterioles? Most important, this point, the important points which you have to understand in this lecture is this: Starling's forces. Starling forces. What are Starling's forces? We will see in this lecture. Then role of lymphatics. Role of lymphatics in maintaining the homeostasis. Then this knowledge you will apply for understanding the mechanism of edema, how edema happens. What is edema?
Accumulation of fluid in interstitial.
Very good. So these are the cells, and this one is intracellular fluid and one is extracellular fluid. But in between the cell, there is some fluid. We call it as, or space. We call it as interstitial space. So if the water or fluid accumulate here, we call it as accumulation of fluid in the interstitium. That is known as edema. Right. So some slides are just the information which is we already covered in the previous, that arterioles are called as the major resistance vessel because the size is very less and the pressure is high here. Radius of the arterioles is important to adjust the blood flow to that organ, or in general, we can say it is important for distributing the cardiac output to the organs according to their need. And the arteriolar radius regulate the blood pressure. So blood pressure regulation is mainly occurring at the arteriolar level. So two things we have seen in the previous slide also, previous lecture also. One is called as decreased size of the or decreased radius of the arterioles, and another one is increased radius of the arterioles, and the in between there is a normal. What we call the normal in the center? What is the name? This is called as vasoconstriction. See, this known as vasodilatation. But what about this one in the center?
Vasotone.
Vascular tone. Vascular tone. Normal vascular tone is the normal size of the vessel. Increased tone, this will lead to decrease in the size, or it is known as a vasoconstriction. Decreasing the tone, vascular tone, if decrease, this will lead to increasing the radius or dilatation of the vessel. So here is the definition is given. Vasodilatation is enlargement of the circumference or radius of the vessel, resulting in because of the relaxation of the smooth muscles, and leads to decreased in resistance and increased in the flow through the vessel. Whereas vasoconstriction means narrowing of the vessel. So this is common terminologies used everywhere. Sorry. And this is responsible for maintaining the arteriolar resistance by doing increase or decrease. Okay. Have you seen this picture before? This is the yes. In which lecture?
I think regulation of blood pressure.
And this is the third time I am showing you this picture. First, I shown you this
Infection
picture.
blood.
Ah, yes, yes, yes. You are right. In PHSL block, we shown you this picture. In the last hemodynamic lecture, I shown you this picture, and third time I am showing you this picture. So normal size of the vessel, we call it as normal arteriolar tone. Vasoconstriction means we say there is a decrease in the size or increasing in the vascular tone. Vascular tone. And increasing in the size when it is dilated, vasodilatation is decrease in the vascular tone. So tone decreases and vessel will become dilated. And here are the causes. Myogenic increased activity, that means if you are stretching the smooth muscles there, it will lead to reflex constriction of the vessel. Or there may be increased oxygen, decreased CO2, or accumulation of the metabolite, then release of endothelin, then increased sympathetic activity or release of vasopressin or angiotensin or application of the cold. All will lead to increased vascular tone or vasoconstriction. Opposite to that, decreased muscular myogenic activity, decreased oxygen, increased CO2, increased release of nitric oxide, or decreased sympathetic activity or increase, you can say parasympathetic, or application of heat, all will lead to dilatation of the vessel or decreased vascular tone. Okay, so what are the mechanism? Mechanism for control of the radius. Local as well as hormonal. Local means within the periphery, within the or near the blood vessel. Blood flow is the primary mechanism that matches the blood flow to the according to the need. So when the muscle starts functioning more, like in case of exercise, blood flow will increase or decrease? Question. If skeletal muscles are contracting and relaxing or exercising, what will happen to the blood flow? Ah, no answer? Are you with me?
Increase.
Increase. So it depends upon the activity of the organ. Activity of the organ or the cell. If the cell is functioning more or the tissue is functioning more, the oxygen supply will become more. That's why it is known as local intrinsic control. Blood flow is primarily matches the need of the tissue. Okay. Second mechanism is neural or hormonal. It is responsible for regulating the blood pressure. That means something which is coming from outside and regulating the size of the vessel, leading to the blood flow regulation. Okay. So it is through the nerves or release of hormones. This is extrinsic because this is not within here, not lying here. Something which is coming from outside and causing the vessel to become dilated or constricted. So either the hormone will come or some neural signal will come. So both of them are coming from outside. That's why it is called as a extrinsic control. Okay, local control, the first one. In our body, brain is the only organ which will have all the time same amount of blood. We have seen in the hemodynamics lecture the picture of change in the blood flow during exercise and during rest. And it shows that every time the same amount of blood is going to the brain. So brain is receiving the the blood always, either sleeping or exercising, the same amount. It will not agree or it will not tolerate any change in the blood flow. Okay. Whereas other organs, they depending upon their activity, the blood flow will increase or decrease. So to maintain the local blood flow, there are some metabolic changes happening there, and also the release of some chemicals like histamine. This will cause change in the size of the arteriolar radius. So it will lead to vasodilatation. Local physical influences are also there. These are the chemical. Now, physical influences which will be like application of heat or cold. Heat will lead to vasoconstriction or dilatation. Heat will,
Constriction.
Dilation.
heat will vasodilate, whereas ice or cold pack will cause vasoconstriction. Okay. Chemical response to the shear stress will also lead to some chemicals released there, and this will lead to vasoconstriction or dilatation depending upon the chemical. Myogenic response based on the stretching of the muscle, based on the stretching of which muscle? Smooth muscle in the blood vessel. Smooth muscles present in the blood vessel can lead to reflex constriction or dilatation. What are the chemical influences? All these are given in the picture. If you remember this picture, all these chemical features are given here and here. In one place increase, another place decrease. But I will show you in the slide also. Following are the specific chemical metabolites, metabolic factor, which are produced within the tissue based on its activity, will produce relaxation of the arteriolar smooth muscle. They causes relaxation of the smooth muscle. If the relaxation of the smooth muscle will happen, what will happen to the size of the vessel? Increase or decrease?
Increase.
Yes, it will cause increase in the diameter or increase in the size of the vessel. So what are the causes which causes vasodilatation? Decreased O2, increased CO2, increased H ion concentration or decreased pH will lead to vasodilatation. Increased potassium locally, increased osmolarity at the local area, release of adenosine, and release of prostaglandin. All of them will cause relaxation of the arteriolar smooth muscle by acting on the endothelium. If you remember the structure of the vessel, you will have inside the cell, the lining of the cell is known as endothelium. So all these chemicals will be acting over the endothelial tissues, over the endothelial tissues, all of them. Hydrogen ion concentration or oxygen or CO2, they all act on these endothelial cells to cause vasodilatation. So endothelial cells are also producing some of the substances. What are these? These are called as vasoactive substances that play a key role in regulating their caliber, their size. Size could be big or small based on the release of certain chemical substance from the endothelial cells. These are the local chemical messengers. These are the local chemical messengers. One of the important chemical which is released by the endothelial cell is nitric oxide, a potent vasodilator. A potent vasodilator, because of the nitric oxide will cause vasodilatation. Myogenic response. Myogenic response means the size, let's say size is initially uh, 2 millimeter, the radius, okay? The radius is 2 millimeter. Certain amount of blood is flowing. Then the blood flow increased. Let's say initially it is 10 ml of the blood is flowing. Now suddenly increased to 20 ml. What will happen to the size or the smooth muscle? What will happen if the blood flow increase to double? Instead of 10 ml, it becomes 20 ml. Heart is contracting powerfully and it is supplying more blood. What will happen to the size of the arteriole? Will remain same, increase or decrease? You have to listen to the lecture. If initially the blood is flowing 10 ml and suddenly it increased to 20 ml, what will happen to the vessel wall or the size of the vessel?
Increase.
Increase, because initially little amount of blood is coming, more blood came, so it will dilate the vessel or stretch the muscle. Stretching of the muscle will cause what? Reflex contraction. Reflex contraction of the muscle, which will make it come back to the original position. So 20 ml blood, first initially 10 ml, become 20, so it stretch. Because of 20, it will reflex contraction and it will bring back to the same 10 ml of the blood. Okay, so blood flow will become normal even if it is increased. And this is happening because of stretching of the muscle. That's why it is called as myogenic response to the stretch, myogenic mechanism. Control of regional blood flow. Regional means any region, any area. Let's say arm or leg or thigh or in the splanchnic area only blood flow. So how it is regulated? These terminologies are important. Active hyperemia. Before active hyperemia, who will tell me what is mean by hyperemia? What is mean by hyperemia? Or what is mean by hyper first? Dissect the term. First will divide. Hyper means what? Emia means what?
Hyper meaning increase.
More. And emia means
Blood.
blood or oxygen, because oxygen is carried through blood. So hyperemia means increased blood along with oxygen. Okay. Active means when there is action. Okay. When there is action. Now we will see the definition. When any tissue becomes highly active, example is skeletal muscle during exercise, what is happening to the rate of blood flow through the tissue? It increases. When the muscles are exercising, this is the muscle. If it is stretched and relaxed frequently, this is exercising muscle. This will lead to more blood flow. As this is increases, we call it as active hyperemia. Many factors are there. Temperature will increase, the oxygen supply will decrease, increase carbon dioxide. All of will cause increased blood flow to this area or to the skeletal muscle, to the active tissues. This is called as active hyperemia. When cells are metabolically more active, they need more oxygen or more blood flow. That's why the automatic mechanism is there, that it will cause vasodilatation. And this will lead to increased or compensated supply or the actual supply of the nutrients, oxygen plus nutrient. This is called as active hyperemia. So any tissue which is becoming active, the blood flow to that tissue will become more. This is called as active hyperemia. Example is exercising muscle. Come back to another term, which is as reactive hyperemia. Here, hyperemia means same. That means increased blood flow. Increased blood flow, hyperemia. But what is mean by reactive hyperemia? In reaction to decreased blood flow. Hyperemia, that is increased blood flow in reaction to decreased blood flow or decreased oxygen supply. How? Let us see here. When blood flow to the tissue is blocked, suppose this is the arm. Okay. And you apply a band here. Tight, very tight band. So you decrease the blood supply here. This will become hot or cold. Hand will become hot or cold.
Hot.
It will become hot. Why? You can try. Tie a rubber band around your wrist, make it very tight, and see your hand or palm becomes cold or hot. It will become cold because the blood flow is stopped here. Okay. When the blood flow is stopped here, or before starting the, let's say before tying the rubber band or the cuff, let's say blood flow to this hand is 10 ml per minute. 10 ml per minute is flowing. Once you apply a cuff here or a tied band, the blood flow decreased to maybe 5 or 2 ml per minute. Let's say, just imagine. So it is decreased. After that, after maybe 5 minutes, you remove the band. Then what will happen after removing the band? The blood flow will become how much? Blood flow will become not 10 ml normal. It will become 20 ml per minute. Normally it was 10 ml. It reduced to 5 ml. Once you remove this cuff here or this band, it will become 20 ml per minute. This is called as reactive hyperemia, increased blood flow in reaction to decreased blood flow. So read here. When blood flow to any region is blocked, the arteriole in this region dilate due to myogenic relaxation in response to the decreased stretch. Changes in the local composition, chemical composition, similar to the metabolically induced hyperemia. After the occlusion is removed, after you remove the band, the blood flow to the previously deprived tissue transiently higher than the normal. Initially, it was 10 ml. Normally, it is 10 ml, but it will increase for some time to 20 ml. Why it will increase to 20 ml? To repay the oxygen, tissue oxygen, which were deficit because oxygen supply to this area becomes less when it was tied. Now there may be too much CO2. So to wash out this CO2 and to compensate the loss of O2, the blood flow will be becoming more than the normal, more than the resting condition. This is called as reactive hyperemia. What is autoregulation? Autoregulation is maintenance of the constant blood flow to the organ. Maintenance of constant blood flow to the organ within itself. No need for from outside, without the effect of any changes in the blood pressure. Even though the blood pressure is becoming high or low, still the organ will receive the same amount of blood. This is called as autoregulation. So autoregulation is found best in the brain because in any condition, brain will use the same amount of oxygen or same amount of blood flow or receive same amount of blood flow. Whereas in kidney, you have seen it was, let's say, 20% in the resting condition, but during exercise, it will become 4% or 4.5%, right? You have seen it. So it is good, but not, or you can see it more in the skeletal muscle. Skeletal muscle at rest, it may be 3%, or during exercise, it will become 160% somewhere. Very wide fluctuation. So poor autoregulation is seen in the muscle, good in the kidney, and best in the brain. So any mechanism, any condition, the blood flow to the brain will remain same or constant. Again, it will be explained by two mechanisms. One is myogenic, another one is metabolic. So myogenic mechanism tell when mean arterial pressure, MAP means mean arterial pressure. Mean arterial pressure decreases, as in case of hemorrhage or decreased blood flow, it will lead to decreased blood flow to the organs. This will cause decreased stretch on the vessel wall. This will lead to relaxation of the smooth muscle, and this will lead to increasing in the size. So initially it was like this. So less blood will make it size increases, and this size increase will compensate for normal blood received by the organ. This is called as myogenic mechanism. Whereas metabolic mechanism or chemical mechanism, when there is a decreased blood flow, this will lead to accumulation of many vasodilator substance like hydrogen, potassium, adenosine, lactic acid. All these things will be accumulated there. This will cause vasodilatation and increasing the blood flow. Here it is. Decrease oxygen, increase hydrogen, increase CO2, increase temperature, or accumulation of potassium, lactate, adenosine, histamine, all are called as the vasodilator substances. These are chemical mechanism to regulate the blood flow. Extrinsic mechanism, the one which is coming from outside to the blood vessel. Either it is a nerve or it is a hormone. Okay? Any hormone or any chemical which is affecting the size of the vessel. So sympathetic nerve supplied to the to the arteriole will cause, if it is more sympathetic activity, constriction. If it is less sympathetic activity, vasodilatation. Hormonal influence like release of epinephrine, norepinephrine, angiotensin, vasopressin, all will lead to vasoconstriction. This is coming from outside. That's why they are known as extrinsic mechanism of control of the arteriolar radius. Okay, sympathetic control is very important in regulating the blood pressure. Parasympathetic does not have much effect. Parasympathetic does not have much effect on the arteriole. So sympathetic supply is everywhere except in the brain. Every blood vessel receive a sympathetic nerve. Arteriole is controlling the nerve except the brain vessels. Brain vessels, they are not received any sympathetic supply. Otherwise, what will happen? If you become so much excited, the blood flow will be becoming less to the brain because of the vasoconstriction. So there is no sympathetic supply to the arterioles of the brain. Now, actual lecture which is related to the microcirculation. Microcirculation refers to blood flow or flow within capillaries as well as lymphatics. Capillaries plus lymphatic vessels. So around 5% of the circulating blood volume, which is equal to 250 ml of the blood, is present at any given time in the capillaries. In the capillaries, it is only 5%. And most of the exchange of nutrient is taking place within the capillaries because the circulation is slow there. This is the diagram to show you the microcirculation from arteriole. From the arteriole, it will become meta-arteriole, then it will become capillaries of the arterial side, then the capillaries of the venous side, and then it will become venule, and then it will come out as vein, and it will go to the superior or inferior vena cava, IVC or SVC. Okay. So in our body, around 10 billion capillaries are there. If you unfold them, the area will become around 500 to 700 square meters. 500 to 700 square meters. That means 250 ml of the blood is present in this much area. 250 ml. So just like painting a thin layer over this big area, 500 to 700 square meter area, you paint it with or spread 250 ml of the blood over this big area. That's why it is a very thin layer, and that's why it will be easy for exchange between circulation as well as in the blood, or exchange between the capillary and the blood. So it is shown here, same thing as we have discussed in the diagram. There are sphincters also. We call it as precapillary sphincter, just like a valve. Precapillary sphincters are nothing but the valve. So when this valve is tightened, they constrict, this will lead to diversion of the blood. There is no blood here now. Blood is diverted directly to the main vessel, through and through fair vessel, to the venous side. So sphincter is causing diversion of the or distribution of the blood between the capillaries as well as the venules. Types of capillaries, as you know, capillary means it is a single cell thick. If you just say 1 cell, 2 cell, 3 cell like this, and on the other side, and there is a basement membrane, just like this is a single cell. Plus there are gaps in between the endothelial cell. These are the endothelial cells. And there are gaps. This gap will allow, this is called as fenestration. These gaps or holes are called as fenestration. This is allowing the fluid to move from the circulation into the interstitial space. Let's say oxygen is there, it can go from here, or some water is there, it can go from here into the interstitial space. So these are called as fenestrations. So the capillaries in the brain, they have got very tight junctions, very tight. It will not allow any molecule to easily pass from blood directly to the brain tissue. Otherwise, the brain function will be changed. So brain will not allow. Brain tissues has got brain capillaries are having very tight junctions. Also, if you see this capillaries in the kidney and intestine, they have got wide fenestration. The hole between the two cell, or the fenestration between the two cell, is more wider. That's why easy passage of the nutrients as well as the waste products can be happening. In liver, it is discontinued. As you are seeing here, they are just like a line. In liver, they are scattered. These capillaries are scattered, discontinued, so that large gaps will be there and they can be used for the big molecules of the nutrients to be exchanged between the blood and the cell. This is these are the differences between capillaries of different areas. How the capillary exchange will take place? By simple diffusion. Simple diffusion means what? Going back to the foundation block. What is meant by simple diffusion?
From high area to low area.
Very good, very nice. If you have two fluids on side A and side B separated by a semi-permeable membrane, if you have more concentration on one side and less concentration or less amount on the other side, it will go from higher to lower side. This is just like a coming from up to down. Okay, from higher to lower side. This is called as simple diffusion. So in our body, in the blood, you have got increased CO2, and in the tissues, you have got decreased O2. So it will go from blood to the tissues. Whereas in the cell, you have got more CO2, and in the blood, you have got less CO2. So it will come back from tissue to the blood. This is called a simple diffusion. Bulk flow of the various constituents of the fluid move in bulk as unit. Most important mechanism for fluid transfer driven by Starling forces. Now comes the difficult part of the lecture. What is mean by Starling forces? So when we have to move the things in a bulk, big amount, then there is a force, we call it as Starling forces, come into action for absorption and secretion. Let us see them now. So this picture shows you the cross section of the capillary, which shows that O2 and CO2 can easily pass from in to out or out to in based on their concentration, and they can be easily passing through the cell because they don't need any gate or pore or fenestration. They can easily, because they are lipid soluble, they can diffuse through the lipid soluble cell wall and they can come out or go inside. But there are some fenestration or gates or holes. They will allow sodium, potassium, and some little amount of water along with them. There are another mechanism which is called as endocytosis or exocytosis. Big molecules can go in or out based on their capacity to form the endocytes or exocytes. Okay, but there is one chemical or one thing which cannot leave the circulation. What is that? The plasma protein. Plasma protein, although the size of the hole is more than the size of the protein, still it cannot go. Why? Hmm. Proteins cannot leave. Suppose this is a cell, proteins cannot go out. Cannot. Why?
Because it's huge in the size.
No, even though it is size is, let's say, 7 angstrom unit, and the size of the hole is, let's say, 12 angstrom unit, still it cannot go. Why? Carrier? Hmm? It needs carrier. It's slightly loud. I cannot hear you. Why proteins cannot leave? Huh? Any idea?
I think
Suppose this is,
it needs
He
a
said
carrier.
he said it needs carrier.
it needs carrier. Yes, good. But even though at the capillary level, it cannot leave without carrier also. Why? Or with carrier also. Why it will not cannot go out? The reason is the this gate or this pores are lined by negative charge, and proteins are also negative charge. So when they will come here, they will be repelled. They will be held back into the cell. Protein cannot leave because they are negatively charged particle, and the holes are also, the pores are also negatively charged. They are lined by negative uh, ions. That's why they cannot leave. Okay, so they will remain inside the cell, and that's why the inside of the cell is always negative. Okay, because of this unequal distribution of the water, electrolyte, and chemicals and proteins, there happens to be some force develop. There happens to be a special force develop. What this force is known as? This force is known as Starling force, and there are two components of the Starling force. Suppose this is a cell. So two types of pressure or forces develop. One is known as hydrostatic pressure. Hydrostatic. What is this hydrostatic? Based on the amount of water. More the water, more hydrostatic pressure. Less the water, less hydrostatic pressure. So water is present in blood. So if you have more water or more blood volume, you will have more hydrostatic pressure. If you measure the hydrostatic pressure at the arterial end, it is 37 millimeter of mercury. At the venous end, it is 17 millimeter of mercury. And also there is one force which is called as osmotic force, osmotic pressure. It is because of the protein which cannot go out or cannot leave. This is called as colloidal osmotic pressure. Colloidal osmotic pressure. So one is hydrostatic pressure, one is colloidal osmotic pressure. Okay, they are represented by two different signs. One is P. P is for hydrostatic pressure. Hydrostatic pressure, or you can say it is blood pressure. Simply the blood pressure. Whereas pi, this is the sign. This is for colloidal osmotic pressure. What is osmosis? Huh? What is osmosis? Can anyone tell me osmosis means what? Hmm? No one knows osmosis? Are you with me? Or you left the meeting?
Yes, we're
Yes.
with you, doctor.
What is osmosis means?
A movement
The
of water
process in
from a
which
Very good, very good. You
It is
told
the
me.
movement of water particle from high water potential to low water potential.
Yes, very good, very good. If you have got two chambers, one is with more water, second with less water. So from high concentration of water to low concentration of water, this is called as osmosis. Now come to the osmotic pressure. Osmotic pressure. Now, if you understand osmosis, you will understand osmotic pressure. What is osmotic pressure? Yalla Hussain.
It could be the pressure from high volume of blood to low volume of blood.
No, please, wrong. Aya. Amer.
Yes, doctor.
Yes.
Doctor,
What is osmotic pressure?
is it the pressure needed to like stop the flow?
Exactly. 100%. The pressure required to stop osmosis. Very correct. To stop osmosis. Very good. So if you want the water do not move from high to low concentration, you apply some pressure. This pressure is known as osmotic pressure. Very correct. So now we have got two pressures present in our circulation or within the cell. One is hydrostatic pressure because of the blood. Second one is colloidal osmotic pressure, which is because of the protein. What protein will do? Protein will try to keep the water with them. Protein will always try to keep the water with them and not allow the water to go out. This is called as osmotic pressure, colloidal osmotic pressure. Now, if you see the circulation, suppose this is a cell and outside is blood, or you can say, okay, outside is blood. So there will be pressure because of water inside the cell, and there will be pressure because of protein inside the cell. Okay, two things are there inside the cell. Water is also there and protein is also there. Because of protein, there is a colloidal osmotic pressure. Because of water, there is a hydrostatic pressure. Agreed? Similarly, outside also, because of water, there will be hydrostatic pressure. And because of protein, if they are there outside, there could be colloidal osmotic pressure. Now two pressures become four. Two here and two inside. Inside two and outside two. Both of them are same actually. So capillary hydrostatic pressure is the hydrostatic pressure because of the blood or water or plasma. Then there is a plasma colloidal osmotic pressure because of the plasma protein. Because of plasma protein. These forces are acting in different direction. These forces are acting in different direction. Hydrostatic pressure is pushing force, pushing, whereas colloidal osmotic pressure is pulling force, pull, it will pull. Similarly, in the interstitium, that is outside the cell, there is a hydrostatic pressure because of the interstitial fluid. And there is a colloidal osmotic pressure because of the protein. Are there any protein outside the circulation within the interstitial fluid? Are there any protein? Suppose these are the cells. Inside is protein. Okay. All cells will have protein inside because just now we have seen. Are there any protein into the interstitium? Please answer me. Are there any protein into the interstitium normally in a
No.
normal condition? No. Why?
Because
Why?
it can't go outside.
Yes, good. Yeah, they cannot go out. So there will be no protein. And we say protein will produce colloidal osmotic pressure. So is there any pressure, colloidal osmotic pressure in the interstitium? Huh? If there is no protein, will there be a colloidal osmotic pressure in the interstitium?
No.
So that's why it is written on the fourth point, interstitial colloidal osmotic pressure is 0 millimeter of mercury. We have seen capillary hydrostatic pressure is 37 in the arterial side, 17 on the venous side. And because of the plasma protein in the circulation, there is a 25 millimeter of mercury pressure is there. That is colloidal osmotic pressure. In the interstitium, there is some little amount of water is there. So there will be 0 to 1 millimeter of mercury hydrostatic pressure is present. Okay, agreed now. So please remember these values. Now go to the next slide. Here you will see that the colloidal hydrostatic pressure in the capillaries, which is represented by PC. C means capillary. And P is nothing but hydrostatic pressure, or you can say blood pressure. This pressure will cause movement of water into the interstitium. This pressure will cause movement of water into the interstitium. Whereas because of the plasma colloidal osmotic pressure, because of the plasma protein, there is pi P. Pi means colloidal osmotic pressure inside the capillary, okay? Similarly, in the interstitium, interstitial fluid, IF means interstitial fluid. Because of water, hydrostatic pressure will be there, which will cause movement from outside to inside. Whereas because of protein into the interstitial fluid, there will be pi IF. IF is interstitial fluid. So interstitial, as I told you, the colloidal osmotic pressure is a pulling pressure. Pull, it will pull. See here, it is in this direction. Whereas interstitial colloidal osmotic pressure is in this direction, pulling pressure. And similarly, hydrostatic pressure is pushing pressure. Push, it will push. It will push the water into the interstitium. Whereas interstitial hydrostatic pressure will try to push here. Okay. Now, based on these four forces, these are four forces now. Out of that, two inside and two outside are there. Now, based on these four forces, the water will be either into the interstitium or it will remain within the circulation. What is this equation says? Coefficient of filtration is equal to PC minus PI. That means hydrostatic pressure in the capillary minus the interstitial interstitial pressure here. Whichever is high, the fluid will go in that direction. Similarly, capillary colloidal osmotic pressure and interstitial colloidal osmotic pressure, whichever is high, out of these four forces, the direction will be decided. Okay. Now see the example here. See the example here. Outward force at the level, at the arterial level. At the arterial level, outward force is hydrostatic pressure in the artery, that is 37 millimeter of mercury. Whereas pulling pressure is IF is 0. Interstitial fluid colloidal osmotic pressure is 0 because there is no protein into the interstitium. Both are in the same direction. That's why you can see here this PC. I am talking about this arrow, and I am talking about this arrow, which is this arrow. 2. Just add these two. This is 0 and this is 37. So total is 37. Okay. Now inward force. Which is this inward force? This force. That is the colloidal osmotic pressure in the capillary and the interstitial fluid hydrostatic pressure This is 1. So total is 26. Inward is 26. Outward is 37. Which one is big? Inward or outward? Which force is bigger? 37 is big or 27 is big?
Inward.
37.
Inward. 37 is not inward. Which one is big? Outward is 37. Inward is 26. Simple, simple. Which one is big out of 37 and 26?
Outward.
Outward. So fluid will be moved outward from the circulation. That is known as filtered. Fluid will be filtered here in this region. Okay. Now come to the venous side. Come to the venous side, venous end of the capillary. Now venous end of the capillaries, again we have to see the 4 forces. The hydrostatic pressure, how much? Here, outward force is 17 plus what is the outward force? Interstitial colloidal osmotic pressure 0. So total is 17 plus 0 is 17. Okay. 17 is outward. Inward force. What is inward force? This inward force. Colloidal osmotic pressure 25 plus hydrostatic pressure. Hydrostatic pressure from the interstitial fluid, this one, which is 1. So 25 plus 1 is 26. Now tell me, outward is more or inward is more?
Inward.
Inward.
Inward. That means absorption. When outward becomes more, it is filtered. When inward becomes more, it is called as absorption. So at the capillary, arterial end, there will be filtration. At the venous end, there will be absorption. Based on what? Based on the net filtration pressure. Based on the net filtration pressure. Based on the 4 different forces, colloidal osmotic pressure or hydrostatic pressure. So at the arterial end, the fluid will move out, that is filtered. And at the venous end of the capillary, fluid will be absorbed or it will come inside. Absorb. Okay. Now tell me what will happen if any of the force will change. Any decrease in plasma protein, or another name is hypoproteinemia, or any increase in the hydrostatic pressure, that is the blood pressure, will lead to edema. Also, there may be change in the capillary permeability leading to release of because of the histamine or bradykinin. It will lead to capillary permeability and it can lead to edema. So edema means accumulation of the fluid because of change in 4 different forces. 4 forces which are known as Starling's forces. Starling's forces. So at the arterial end, there will be filtration. At the venous end, there will be absorption. What is the role of lymphatics? What is the role of lymphatic? You know, these are the cells, okay, in a tissue. This is an interstitial space. This space will have little amount of water. And there will be one vessel is coming from here. This is known as the lymphatic. They are known as blind vessel because they are closed at one end. They are closed at one end. These are called as blind vessel. So total amount of fluid moving into the lymphatics is about 2 to 4 liters per day. In 24 hours, the circulation is about 2 to 4 liters. They are lying in the interstitial fluid close to the vascular capillaries. They merge to form the large lymphatics, and then eventually the largest one will be the thoracic duct, which will open into the veins. So whatever fluid is there, it will be absorbed and it will be taken to the venous system. Example of lymphatic circulation is just like mopping the floor. You might have observed in the bathroom there is a cleaner always when you make wudu or you use the wash basin. Some little amount, some drops of water falls on the floor, and the cleaner usually use the mop to absorb all these droplets so that it will remain clean or dry. This is nothing but the action of capillaries. Capillaries, it is the action of lymphatics. So lymphatics will always try to mop the interstitial space so that no more fluid is lying in the, or very little amount of fluid is lying in the interstitium. Interstitial fluid enters the lymphatics through the loose junctions between endothelial cells. Lymph will flow back to the thoracic duct and by the contraction of the smooth muscles in the lymphatic vessels. When lymphatics are blocked, then there will be edema. There will be accumulation will become increase. Okay. Okay, what is edema means? Edema means accumulation of the fluid below the skin or maybe in around the cavities like pleural effusion or pericardial effusion or peritoneal effusion, peritoneal fluid. All these are examples of accumulation of fluid. Here you can see under the skin, loose skin, there will be accumulation of the fluid, or maybe sometimes there is a fracture or damage or sprain, there will be edema over the damaged joint, or maybe even in the normal person also around the ankle. If you are hanging your limbs for a long time, there can be edema. How you diagnose the edema? You just press the skin for maybe few seconds and then leave. You will find a depression. Skin will be depressed. You will press and you will find a depression. That is called as spitting. The edema is present. Okay. Now, causes of edema. Causes of edema you can classify based on the 4 different forces. What these 4 different forces are known as Starling's forces. Starling's forces will decide the edema. Let's say increased capillary pressure usually happens in heart failure or kidney disease or pregnancy. This will lead to increased outward force. Outward force. This will lead to edema. Also, venous obstruction like thrombosis or liver diseases can lead to increased capillary pressure, and this will lead to fluid accumulating in the interstitium. This is called as edema. What about decreased colloidal osmotic pressure? Because this is the force which will hold the water inside. If proteins are inside, they will hold water along with it. If proteins are lost, the water will go out. So loss of proteins, like in case of nephrotic syndrome, when there is a damage to the filtrating membrane of the kidney or nephron, this will lead to loss of protein in the urine, and this will lead to colloidal osmotic pressure decreases, and the person will have, or the baby or child will have, edema over the body. Burn. During burn, the plasma loss is there. Plasma and the plasma protein. And the plasma protein loss will lead to edema. That is decreased colloidal osmotic pressure. Even in sometimes there is no loss but decreased production. Decreased production like starvation, malnutrition, or liver is the site for formation of proteins. If liver is get damaged, then proteins will be not formed in a proper amount, and this will lead to decreased colloidal osmotic pressure, leading to edema. So causes of edema are based on the force which will decide. Increased capillary permeability, as in case of inflammation, allergic reaction, tissue injury, or malignancy, the fluid will come and lie in the interstitium here. This will also causes edema. Obstruction to the lymphatics. As we have seen, that within the interstitium, the lymphatics are mopping out the the small amount of fluid. If these lymphatics are blocked, then the fluid will accumulate, go on accumulating, and this will lead to edema. This is seen in case of surgical removal of the lymph nodes, in case of breast cancer or any cancer which is to remove the cancer, we have to remove the lymph nodes also, because they will be spreading the infection and spreading the cancer cell to the other side. So most commonly, the edema of the upper limb found in breast cancer after removal, after surgery. Even sometimes malignant obstruction of the lymphatics can lead to edema. There is one condition called as filariasis. Have anyone heard about it? Filariasis.
Yes, it's like elephantiasis. It's called. It's when the
Like,
body is
yes,
full.
yes,
Yeah.
the limb will become like a elephant limb. The
Yes.
limb will become like a elephant limb. This is because of the infection occurring in the lymphatics. Lymphatic blockage is happening, and that's why it will become like a elephant limb. So all these are the causes of edema. So whenever the question comes to you, the person is suffering from edema, you have to think about 4 different forces. Okay. Basically, these 4 forces are not 4, actually they are 2. One is hydrostatic force, another one is colloidal osmotic force, colloidal osmotic force, osmotic pressure. And there are 2, inside the circulation or capillary and outside, inside and outside the capillary. This is also, colloidal osmotic pressure is also inside the cell and inside and outside. So based on this, which one is more powerful? The force will be, resultant will be either edema or no edema. Okay. Any difficulty in this?
No, it's clear, doctor.
No, clear.
Thank you very much. There are so many students absent in today's class. They have to compensate by themselves.
What about attendance?
Attendance is recorded because of your name. When you join, it is already detected that who you are, from which block, or what is your number and what is your email. Okay.
Thank you very much, doctor.
Welcome.
Thank you, doctor.
Welcome. Welcome. Thank you. I will stop the sharing. My mouse is not working. Stop sharing and stop recording. You will see the recording in the chat, or I will send you the link. Don't worry.